We still have people coming in through our waiting room, so we're just going to give them a few more seconds and then we'll be starting. Welcome, love to see everybody's names and pictures out there. Looks like we've got everybody in. All right, everyone, we'll get started. My name is Renee Hamilton-Combe. I'm the Executive Director of the YWCA, and I have the distinct honor of welcoming everybody today. We're real excited to have this discussion on our stand against racism as part of our program here. We're also joining with many of our sister associations across the nation. YWCAs just across the nation are having similar events in terms of panel discussions and really working to move the conversations forward about eliminating our mission work of eliminating racism. So real excited to have our panel join us today here on Kaua'i, to have all of you join us here as we talk about racism as a public health crisis. All of us who have, seen the news lately, it's been quite a tremendous week in terms of trials and other issues and cases that just continue to pop up. And we just couldn't be more timely in this conversation. And we know that today's conversation is, again, just one of many that are happening, but also the beginning of work that needs to continue and that will continue. We're dedicated here at the YWCA to our mission work of empowering women and eliminating racism, promoting peace, justice, dignity, and freedom for all people. And as I've always said, I'm really fortunate to be able to work for an organization with that kind of mission. We have people with the passion, the knowledge, and the expertise to really lead this conversation today. And very grateful for all of our panelists and everyone involved in putting this together today. So I appreciate you joining this conversation. Invite everyone to join in this work. Join us, whether at events or anything in your daily activity, to move this work and our country, our community forward to for racial justice. It's time for healing. It's time to move this forward and really have equity and peace and well-being for everyone. So I want to introduce our moderator today, Amiko Meyers. She's going to work through all kinds of different questions and topics. It's going to be a fascinating conversation. Amiko is our current board president of the YWCA. She is one of the partners of Myers & Myers law firm here on Kaua'i. Amiko's been involved with the YWCA for many years. She left a little bit. When she came back, we're immediately, Amiko, come back on the board. So Amiko's been really, truly sharing her gifts and her talents and her leadership on the board for many years, and very, very grateful for that, Amiko. Amiko is a working mom. She's got 2 children and just has done a lot of work, and I know has a lot of passion in her own heart and in her life for racial justice work. So Amiko, thank you for being here, moderating, and for your leadership in this issue. I'll turn it over to you.
All right, well, thank you for that very nice introduction, Renee. I appreciate that. Been involved with the YWCA for a number of years because I strongly, strongly believe in the mission and the work that they do, both nationally and most importantly here locally for our community. So it's just a couple housekeeping things before we start off on this discussion with our distinguished panel. We are asking that you all keep your video off and yourself muted. This is as a meeting format and not a webinar format. So we do ask that you do that so that we're able to hear our panelists and when they answer questions. And then at the end of the panel, we're setting aside some time for some question and answers. And so we're asking that as questions come up that you in the comments section on the right, you send a chat or a comment and with a question, and at the end those will get forwarded to me, and we'll try to get through as many of those as we can towards the end of the panel. So with that out of the way, I really want to thank our panelists for joining us today. We are really lucky to have such distinguished people here to speak on the issue of racism as a public health crisis. First, we have Dr. Andrea Hermosura, who was born in Honolulu and raised in Kaneohe, Hawaii. She graduated from Kamehameha Schools and received her PhD in clinical psychology from Manoa. She is a Native Hawaiian licensed psychologist providing individual, couples, and group therapy. She is also an assistant professor at Manoa's John A. Burns School of Medicine in the Department of Native Hawaiian Health. Her primary research interests are in health disparities, social and cultural determinants of health, community-based participatory research, and patient safety. In addition, she practices at the Physician Center Mililani, where integrated primary care and behavioral health services are provided. Thank you so much for joining us today. Next, we have Dr. Puanani, born and raised here on Kaua'i. She graduated from Kamehameha Schools Kapalama and received her undergraduate degree in psychology from Oregon State University and her PhD from the University of Hawaii at Manoa. She is a clinical psychologist for the State of Hawaii Department of Health, Child and Adolescent Mental Health Division and the Kauai Family Guidance Center. In this role, Puanani provides clinical case formulation, treatment direction, and service authorization for youth with mental health concerns and significant functional impairment. Her research focuses on identifying patterns of effective practice in community care settings. She is passionate about system of care improvement and increasing access to quality health services for underserved communities. And I would also like to add that we're very lucky to have her as a board member here at the YWCA as well. Next, we have Blanca Gail Lopez. She is an anthropologist and immigrant from America Latina. She holds an MS in anthropology and more recently a master's degree in public health. Although an early career professional in public health, she has worked in promoting access to services among immigrants for over 5 years. In 2019, she joined the Kauai District Health Office as a public health educator for the Bilingual Health Aid Team. This team is a group of 4 women of color and ESL speakers from different backgrounds. Blanca has learned through her personal experiences that the understanding of the system, including language, legal framework, available services, and advocacy, all play a key role in shaping the health of our families and communities. Her work focuses strongly on facilitating access and community connectedness to counteract systemic barriers. All right, thank you so much to our panelists for being here. And so the format that we're going to do, I'm going to start off with a question that will go to each of you. So each of you will answer this question, and then I'll go to more directed specific questions, and I'll address them to you individually. So the question that we're going to start off with, then we'll start with Dr. Hermosura. We'll start with you. Can you explain how racism and health or public health intersect?
Sure. Okay. So aloha mai kako. Thank you for having me here today. I think that racism and public health intersects because there's such a long-standing history of racism in Hawaii, the United States, and across the world. And this history of individual and structural racism that spans generation really denies opportunity to people of color or other marginalized populations and robs them kind of their access to and right to physical and mental health, good physical and mental health. And we can see that those disparities, so a lot of the work that I do is in health disparities, but we can see it in the health outcomes that disproportionately impacts certain groups more than others. And so, for example, Native Hawaiians and Pacific Islanders tend to have higher rates of depression, diabetes, morbidity, mortality, infant mortality, and more recently, COVID-19. So I think that because it crosses many sectors in our world, it definitely is like a public health crisis and something that affects all the entire population.
All right, thank you. Dr. He, would you like to answer the same question? Can you explain how racism and health and public health intersect?
Sure. I think Andrea had a really set a nice foundation for us. And the things I think I'd like to emphasize or maybe add is just considering both the individual and either systemic or institutional forms of racism as drivers in prohibiting what we would consider to be quality care as a real big impact then on the healthcare of people, particularly those of Black, Indigenous, and other peoples of color, so marginalized populations. The other thing is that many of the folks that we serve through the public healthcare system also receive care through several different of the public system sectors. So whether it be the child welfare sector for kiddos, educational sectors, and other governmental systems that also may have systemic or institutional factors that may prohibit quality access and then may also impact healthcare. And then the last thing is just that, this is really a multifaceted area. And the thing that comes to mind, and Dr. Hermosura and her team is really doing some great work here locally. However, historically, there have also been some limitations to who and what is getting studied in the research, how programs of research are funded, and really so what types of professionals in healthcare are getting recruited, are getting trained, and getting promoted. So a specific example to get back to the research piece, and granted, I think we're moving away from this. So I want to put that caveat on it, but historically, a lot of the standardization samples, so what we consider to be typical or normative for psychological research, were really based on, it's kind of a strange acronym, but WEIRD. So Western, educated, industrialized, rich, and democratic societies. And that's not necessarily representative. And so, again, I think we're moving away from this. There's so much more work to do.
Great, thank you. Now, Blanca, would you like to also chime in on how you explain how racism and public health intersect?
I think a lot of the main concepts of discrimination and racism were already touched by both doctors. The only thing that I would like to add is kind of sometimes how, or most of the times, how our conversations about racism outside of public health are when we talk about Black and white. And often we get into the idea of oh, that doesn't touch me, or something that happened to someone else, is outside of what happens within our circle or what happens within our families. And we know in public health that is much more complex, but not complex than that. We know it affects everyone regardless. If you were affected, if you think you were not affected directly, if you were not the person in the news, it does still affect you. And that little piece of what happened to someone else, or the white and Black conversation, is just one way in which racism operates through a system, and it is a system. It is much more complex than just a situation that happened to one, an action that happened, a situation that happens to one person. It expresses itself into advantages and disadvantages, unfair advantages too. It's not only those who have higher income, they're going to have a better health outcome, which is a way in which it overlaps with public health, but it's also how do you get to those advantages? How much of history behind is putting you to a better health position, is putting your family in a higher income. And the way I see it in public health, or the way I see health in general, is health is kind of a road, and the way you get to the exit or to the end of the road is if you tend to be of a lighter color skin in the US, this is talking only about the US. If you happen to be in a whiter color skin and coming from a richer family, then your way to the end of that road is much straight and it has less obstacles and you have the best car to get there. But everyone else that doesn't have that advantage and doesn't have many other advantages, doesn't have access to education, doesn't have access to better healthcare, doesn't have access to quality healthcare, language, all these things, they need to go around, they need to go up and down, they need to fix the car so many times. So it's gonna get, it's so much harder for those who do not have the advantages to get to that road. It doesn't mean that those who get like there faster, it doesn't mean that they didn't get through, they didn't go through the road they did. It was just easier for them to get there. I think that's kind of the only addition that I will put on top of the other explanations about how public health and racism and how health and racism kind of overlap. I think we have been able to see a lot of these things happening already with COVID-19, and it was clear for us that we really had to pay attention to specific disenfranchised communities when the COVID-19 lockdowns start happening, because we knew they were going to be more affected because of those already historical factors that were playing a role in their own health. So yeah, there are many ways, but I'm really happy we're having this conversation and expanding on how racism play a role in our own individual, but also community health.
Great, thank you so much. Okay, so the first question we have is for Dr. Hermosura. And the question is, the idea that racism doesn't exist in Hawaii remains prevalent today. We hear that a lot, and I think we feel like our issues are different over here to some extent. How would you respond to that statement?
Yeah, it's a really frustrating statement for me personally, I think, because people look around and they see such diversity in terms of race and ethnicity. And then there's like the ideas about Hawaii being a melting pot or like a place where everyone can come and feel like they belong. But just because diversity exists, it doesn't mean that racism does not exist. And to say that racism does not exist here in Hawaii really ignores the deep-rooted racist history that we have in Hawaii, and that I as a Native Hawaiian, because I have to qualify that I look at Native Hawaiian Pacific Islander health mostly. So that's kind of the lens through which I'm going to be talking. But to ignore the colonization that happened, the banning of Native Hawaiian language, culture, practices, seeing like the significant decline in our population within a short amount of time, saying that racism doesn't exist ignores all of that and kind of continues to perpetuate the idea that, like Blanca said, that everyone's afforded the same opportunity to get to the same destination. And Kamara Jones really does a great job of defining structural racism, and by saying that it unfairly disadvantages certain groups or people while unfairly advantaging groups of people. And by doing that, you're really kind of sapping the strength of the whole society, because you're wasting human resources, right? So if you assume that a person, based on the way that they look, cannot be a good leader, for example, then that's flawed. That's flawed kind of thinking, and it really limits our ability to be innovative, to be healthy, to kind of come together and look at different perspectives and use those different perspectives to address issues that are impacting our population as a whole. So I think there's a lot of evidence, including health disparities, for the fact that racism exists in Hawaii. And if people are following like the I Remember story or the shooting by police in Uanu, there are issues that are happening nationally that are also happening in Hawaii, and that are important in the conversations that we should be having, and that in the perspectives that we can consider taking moving forward. So that's my respond to that
Thank you.
question.
Do either of the other panelists have anything they want to add to that or comment on that? Yeah, Renee? No?
You know, again, I think Andrea, frames things so nicely, but I think similarly, I think it's an incredibly frustrating statement to make, and one that we have a lot of work to do to go about addressing. Given both, as Andrea said, the historical factors, if we think about colonization and explicit stealing and of Hawaiian lands, explicit actions that prohibited in many ways, progress is not quite the right word, but progress for our people, and also really highly impaired just the health status, but the status generally of the lahui. However, there are several things happening today also that are both current events, but current structural issues that certainly serve as growth areas. And as much as I think that we learn a lot about race relations here in Hawaii, there are certainly areas that we have to improve upon as well. Saying that Hawaii's not, or the idea that racism doesn't exist here is also potentially harmful, because it creates some biases and assumptions that then prohibit us really from openness to then changing behavior. And one way to then address that, I think we're getting to that a little bit later, but is having the conversations, as a starting point, such as what we're doing here today.
Okay, thank you. And actually the next question is for you as well. And it's, how has the mental health field addressed the impact of racism on communities of color? And I guess the follow-up to that would be, is it enough?
So I think this is an area we're certainly paying much more attention to. I think Blanca earlier had really alluded to COVID-19 also, and in some ways I think that the experience of COVID-19 has really, and the experience of several of the, current events in the world, explicit murders of Black individuals that we're seeing nationally, for example, have really prompted shifts to the work that we do and greater attention to the work that we do. I think that there's a multifaceted approach that's happening right now, and that hasn't only happened because of the more recent experiences, though I think there is much more energy behind it. I think one of the things is really funding and research efforts to look at both causes and effects of racism, try to address, disparities in both mental health care, but health disparities as well. And then also looks at things like the effects of microaggressions. Another thing happening, I think, and again, and not just currently, there's been work in this area previously, though I think there's more attention now, is really trying to develop specific interventions, both that are focused on the individual level, but also broader community and system level, to try to address some of these, the impacts of racism. And then I think there's some really detailed ways that we're adjusting practice. I had mentioned COVID-19 previously, and part of the reason I brought that up is because the nature of the explicit push to shift work and to really utilize telehealth as a method of treatment modality, I think has really has had its limitations, certainly, but also has really allowed us to have a greater scope of who we're able to serve and how we're able to serve, and I think has allowed us to reach clients that perhaps we did not previously do so well reaching because of the expectation to come into the office for a therapy session, for example. And then I think there's several ways we're identifying being able to mitigate race-related stress. It's hard when we're putting that expectation on the individual and the client who is experiencing that race-related stress. But I think, again, it's a two-faceted approach. We want to change the system, but we also want to support the individual or the community also. And so I think that often is looking towards, resiliency within culture and cultural healing techniques. That can also be through the development of things like coping skills as well. Could certainly go on and on about this, but I have a feeling some of my co-panelists may have some ideas here too. So I'm gonna pass the torch along to them.
Great, thank you. Do either Andrea or Blanca, do either of you want to jump in on this one and address this as well? Anyone? No? Okay, in that case, then we'll move on to Blanca. We have a question for you. So since 2019, policymakers from more than 50 American municipalities in 3 states have formally highlighted racism as a public health crisis. And I think that bill was introduced, I believe, this week. You probably know more about this, but a bill was introduced here in Hawaii to, I think, declare racism a public health crisis here. I guess, you probably can't really say come out one way or the other on that particular policy, on that particular bill, but in general, what material impact do you think that could have if something were like that were to pass here?
I think in general, and I do want to make a clarification. I am, as you mentioned in the introduction, I'm an immigrant. I'm an immigrant to the U.S., but I'm also an immigrant to Hawaii, and my perspectives or the conversations that I hold, they come from a place of respect and appreciation of the opportunities that I have and the people that I get to work with, and the communities that allow me to be part of them or allow me to connect with them. So that said, I believe we're overdue. I believe not only as a state, but also as the country, the whole country is overdue to call it a public health crisis. And more than who is calling it a public health crisis, because this, as I said, these conversations are happening at the public health level, but we need these conversations and we need people acknowledging and working around racism outside of the public health sector, outside of the academia. Who do we need to be part of this conversation? I believe for us to be able to have meaningful change and meaningful impact in the communities that continue to be more impacted by racism, and this is everyone, but we do focus on those who are disproportionately affected by racism. So we actually need to have different levels of intervention, different people working on these, different agencies, different communities, different businesses, both private and public, need to be part of the conversation. So if making it a formal, making it a formality, and we make it this is a program, this is an office, this is we're gonna start working into funding for programs against racism and working in public health. If that helps to move those actors and put them all together to actually get things done, I think that's much more important to the actual conversation of which county or which office is calling this a public health crisis. As for what is the material impact that we may have, I think it makes life better for everyone. It gives better health outcomes. It gives healthier communities. It gives safer communities. It gives, and as Dr. Hermosura was saying, it gives the possibility of exploring that human talent and that human resource that we haven't been able to explore because they haven't had the opportunity to access those careers or access those spaces to be part of some of those conversations. So I think that if we go back to the idea of racism is a system, then we also want to go back to the idea, okay, so how do we start addressing a system that if it was created, it can be also modified, it can be also altered and make change that is going to be actually meaningful to the communities that we need them to receive it. I also think that part of, and maybe this is going to come up later on, or what are the things that we can do about it. But when I think about calling it a public health crisis, I think about how are we going to keep accountable people that want to call it a public health crisis. If we think about elected officials, or if we think about programs in place, if we think about economic impact of COVID-19, like, and we want them all to be part of the conversation, public health change, and how we take or how we address racism into all those programs or all those sectors of our society. How we're gonna keep ourselves accountable and keep moving forward away of the idea of like, oh yeah, we already call it, but like what is the action? What is gonna happen next? Is it gonna 6 months from now? Are we gonna be doing something about it, or we just depend on the funding from a grant? Yeah, so I'm curious to hear what my co-panelists feel. How do they feel about this?
Yeah, if I can chime in.
Please do.
Blanca. I think I wanted to acknowledge that Sade Freitas is on this call, and she was really one of the people who was instrumental in putting one of those bills forward. And I think, bringing policy around it really has the potential to attach like resources to do the change, but also to like reiterate what Blanca said, to hold people accountable and institutions accountable. And it's kind of the first step to seeing systemic change, I think, around this issue. I mean, we can have a policy, but it doesn't always mean that it's going to be implemented. And so how do we do like the policy component, but also the implementation of it, and talking about how to operationalize that and what that would look like in practice is critical to this work. But now we can start having these discussions at a state level and in relationship to national conversations that are happening also. So I'm really excited about the possibility that these bills pass, if they didn't already. Sade can correct me if they did. So sorry.
Pua, did you want to jump in at all on this one? No.
Already well said.
Okay, great. Okay, and going back to you then, Andrea, what is the relationship between racism and the disparities in healthcare and healthcare outcomes? I think this has kind of already been discussed a little bit, but if there's anything you want to add to that.
Yeah, so I kind of spoke to that, but so if I think about racism as a system of inequity that can lead us to have like implicit or explicit racial biases towards certain groups, and using like kind of the evidence of a disproportionate burden of mortality, morbidity, and different chronic illnesses being experienced by marginalized groups like Native Hawaiians and Pacific Islanders. I think that, we are starting to see patterns in the way that they come out. Some research is showing that healthcare professionals are just as likely to have implicit racial biases as the wider population. And I think that's important because being a helping professional, like a lot of us don't go into it thinking that we want to harm people unintentionally or unintentionally. Yet, if we look at the societal narratives that create the biases that we may or may not be aware of, they can impact. Like, so the research, there's a literature review done by Manoa and colleagues in 2017. And the most consistent finding that came out of that literature review was that implicit biases play out in patient-provider communication in real-world settings. And so some of the examples that they talked about was that physicians or healthcare providers tend to display more negative affect, tend to be more verbally dominant in certain conversations. They tend to slow down the rate of their dialogue and be less like emotionally responsive to patients. And so I think even though that's in healthcare specific, it can definitely be generalized to a lot of the interactions that we have. And because implicit racial biases come out in those ways, one of the things we can do is kind of self-reflect and pay attention to how we interact with certain people, how we, the questions that we ask, and why we're asking those questions. And then are we listening when other people talk, or are we kind of quickly trying to respond to what we think we hear? But I think just kind of to expound on the idea of racism and health disparities, but also racism and implicit and explicit bias, and how that can also affect healthcare and healthcare outcomes is an interesting and important conversation that's going on now.
Yeah, definitely. Does anybody else want to jump in on that one? No? Okay. All right, moving on. Pua, can you talk about the generational trauma of racism, both what it is and how it can affect a person's mental health?
Sure. I think there are a couple of ways that it can affect mental health, and so I want to make a couple of points here. The first is just that racial trauma can, sorry, let me take a step back. I should mention that my primary work is with children, adolescents, and their families, so I'm often thinking about both the impact that caregivers can have on their kiddos and about the family system as well. So one of the things to be thinking about is that racial trauma can really impact people of color and indigenous individuals from, I think they've said, from cradle to grave. You know, if a kiddo has an experience of racial trauma younger in life, it can even affect how they experience their sense of self. It might affect their own mental health or healthcare and, you know, interactions with others, all those sorts of people. And these effects could, not always, but could have the potential to go beyond just that individual to the relationships they have with others and ultimately communities of color. The other piece here is that racism can really also have an impact on how caregivers parent their children. And so given that racism can impact, you know, an individual emotionally, physically and spiritually as well. And so then that can have some pathways into how a caregiver is then interacting with the child that they're raising, and can also really lower their capacity to engage in more effective parenting practices. So this can make it more difficult for a caregiver to engage in methods of self-care they might otherwise have in terms of being able to take care of themselves and also being, again, an effective parent. So those are maybe some of the more indirect pathways, but I think some of the real work in this area was really made known, and some of the earlier research was done by Maria Yellow Horse Braveheart, who really helped to identify contributions of factors like colonialization and systemic oppression also on behavioral health disparities for indigenous individuals. And ultimately, what these studies have shown is that, you know, this historical trauma and intergenerational trauma has had adverse health impacts and has even, you know, been suggested to alter genetic expression. So several pieces to all of this. One caveat is that given, you know, in this work, I think it's always really difficult to tease apart these overlapping but different forms of racism or trauma. So was it a, you know, when we think of a health outcome or a mental health outcome, was the causal factor a recent, you know, experience of racism, or is it something that we consider more that historical trauma, intergenerational type of racism type of experience? So still a lot of work in this area, but also I think some clear outcomes that we're seeing as well.
Okay, just before we open this up to the other panelists, just kind of want to follow up that with talking about like the emotional impacts or secondary trauma maybe to bystanders or to other, you know, if you, I mean, I think during the trial, say of Chauvin and the people who were standing around who witnessed the murder and like the obvious pain and guilt that they felt. And so what is the impact on practice, not specifically? Are you there?
Yes, okay. So absolutely. So I definitely think there, you know, and it's been, you know, we've had a pivotal and very publicized in the media example of this recently, but taking a step back, the definition of bystander can be relatively broad also, and including just anybody who's aware of and is able to recognize some sort of unjust behavior that warrants like comment or some sort of action. And I think what we saw by some of the bystanders in the trauma is that there were different levels of action that was taken, or potentially different levels of inaction. So, and certainly related both emotional, spiritual types of outcomes, but also a lot of, I think, questions too. Was there something more that could have been done? If I had behaved in a different way, could there have been a different type of outcome? Is there something more that I should have done? For bystanders, actually sometimes inaction is even the norm, perhaps without knowing what to do or how to go about doing it, or due to other layers of barriers. Maybe even that there's not a system that supports the doing, for example. So I think certainly potential for several different outcomes, and moving away from the trial specifically, one other that might be a little controversial, but in thinking about action or inaction, as a bystander, there's a potential outcome of, if I act, am I making the situation worse in some way? And that can have implications also. And I think that it's really difficult to know in the moment, but there's also a lot of reflection afterwards around the woulda, couldas, and shouldas. So certainly a spectrum of different potential outcomes, but a lot of growth area in this growth for this area as well, even in some of the smaller things that one who is a bystander might be able to do, whether it's checking in with the person, whether it's speaking up, and whether it's really raising awareness for some of these issues also.
Okay, thank you. Does anybody else want to jump in and respond to any of this, any of these issues? No. Okay, you did awesome, Pua. Okay, moving on to Blanca, I have a question for you. So we know that on the mainland, COVID-19 pandemic has had a disproportionate effect on communities of color. And have you seen this to be true with our Native Hawaiian or Asian Pacific Islander or Black, Indigenous people of color populations here in the islands? And if so, how has racism played a part in that?
Yeah, we know this information because of data, right? Like that's kind of what we get from the other states, is the reports on how it affects like this community and this community and this community. And we were not ready at the beginning to be able to show the data because that's how systemic racism works. We don't have those things in place. We ignore the information. We ignore that there are several different groups within the Asian Pacific group, within the Latino communities, within the people of color communities, within the Native communities. Like, we just put them together in big groups and compare. But this is also a testament of like, the system can actually be changed, because within, I'm gonna say, a couple of months, we were able to start, we were able to see, we some of that data became available, and then some of the data, they start collecting the data in a way that we can actually identify some of the most affected communities based on race and ethnicity. So I think that as an example of how racism works, with data is the best example of how at the beginning we were not able to see all of these numbers, and we just and that changed in part also because of the call from many of the states and from many different communities of like, we need to know what's happening with these groups. We know they're getting higher rates of infection, but why don't we have these reflected in the information that we have? So so I guess the answer yes or no. Yes, we have seen it, and I think this is a new or stranger. Like, this is not a strange to any person here in the conversation. Like, when we check for the when we had the highest numbers of COVID-19 infection in Hawaii, this was summer last year, and it also happened in Kaua'i, which kind of had the same peak. Those who were most affected, or those who had the higher rates of COVID-19, were not those that are more represented in the community. So let's say I do have the number of at least 7. No, this is for last year. For example, the communities that come from or are part of the COP agreement, which is the marginalist communities, the communities from Palau, and the communities from Microaggressions, they were represented as, I believe, 24% of the cases, or the Pacific Islanders were represented 24% of the cases. And they only account for less than 5%, or I think 4% of the population in the state. So this is much, much higher than what we were expecting. So I think it is as a complex system. It is an expression of like many things not working out, and if we were to unfold some of why this is happening, why in a specific community, why specific families are being more affected by infection rates, we need to start looking back. We need to start checking what is their access to health, what is their access to information, what is their access to housing, what is their access to sick leave days, for example. What is how safe are they in their communities? Not safe only about safe in terms of how freely can they go, like how easy it is to go for them to go and ask for resources when they need it, ask for food without having to demonstrate a citizenship status, those kind of maybe not, those are kind of the things that we may not see when we think of like people, oh, there is food available, or there is healthcare for low-income families. Like there are many, many steps, or there are many barriers that people need to face to be able to access those services, and that is even harder in among immigrant communities, among low-income families, among families with this history of inequity, wherever they're coming from. I think another example is frontline workers. So it became very obvious for us, like how the essential workers how the communities of color were overrepresented in the essential workers category, when only them were able to go to work. So if you go to the supermarket, if you go to the hospitals, like most people that were working there were people of color. So that if you were to ask, like, how many of them have actually health insurance, how many of them have paid leave, how many of them had proper PPE to be able to protect themselves and not bring virus home, how many of them have fair housing or access to fair housing. So it like I just there is no for us, there is no way to deny that racism play a really it keeps playing a really complicated role into the health of these communities, but also into how they face and how they recover from COVID-19.
Yeah, if I can add, Amiko.
Yeah.
So there's actually a COVID report to address health inequities that came out of like a partnership with JABSOM and the Department of Health and other important organizations. But they did talk a lot about how even though the pandemic is affecting us all, it continues to disproportionately affect certain groups, certain race and ethnic groups in Hawaii. And that has to be because of issues like racism and access and like the access to certain things that are afforded to certain populations more than others. And so I can share that report. Oh, she did. Okay, Blanca did. Blanca just shared the report. So I just wanted to emphasize that because there are conversations and important moves being made to like disaggregate data and the importance of this disaggregating data so that we can have the right conversations. And you can see it kind of in the rollout of the vaccination clinics. You can see how it's targeted towards certain groups who have access and who can drive to places, but kind of ignoring a large percentage of our population who are more vulnerable and more at risk, but don't necessarily have the resources to do things. So thank you. Sorry for jumping in.
No, thank you.
Thank you for that reminder. I had the link ready because I really wanted to share. Not a lot of people have seen that report, and it's the first of a series of reports that they're going to make. So I look forward into a report that is going to include Latinos and Black communities too, because we're not part of that report. So yeah, we'll see, but it's the first one, and I say I'm happy the conversations are happening, but we're overdue. And there's the right step forward, but we're still a long way to go.
Yeah, thank you. And the report that she's referring to is, the link is posted in the chat section. So if anybody is interested, please definitely check it out there. Okay, this question is for Andrea. Outside of service providers, how do you recommend that we engage more people in our surrounding communities, including youth, in these conversations and next action steps?
I think the most important thing is kind of creating the space to have these conversations. You know, like creating like the space that we're in currently, where this is the topic of conversation, and hopefully making it safe so that people can ask questions and like considering intergenerational factors. So I've been finding like younger people tend to be more well-versed in these kinds of conversations, and they're reporting challenges in having those conversations with their parents or their grandparents, and, you know, kind of helping them bridge those gaps. And so I think just kind of creating the space for it is, and the opportunity to have those conversations with one another.
Anybody else want to add on to that with any ideas?
I would like to add something, and this is for those who are willing to have the conversation. Like if you're in that stage of like you feel like you are open to have the conversation, whether you're a person of color or you're a white person. When we talk about racism, we're not pointing fingers and telling you are racist and racist. Like we're not calling it racist, we're calling out racism. And the fact that when we have the conversation, you feel, or other people may feel threatened, it to me is kind of a red flag of we may not be approaching this the right way. And I made that mistake very often, especially because sometimes when I get into those conversations or when I start pointing those things, I'm already exhausted talking about it. I'm already exhausted seeing microaggressions, experiencing microaggressions, and the frustration that we were talking about at the beginning of like not addressing racism like openly. It also expresses in like, I do want to have this conversation with you. I do want to move forward, but you need to understand that when people of color address this topic, we come with a big load, and it's both emotional and it's both hard to put into words sometimes, because it's part of experiences. And I think when you are ready to have these conversations, I think you also need to understand that this is not about you as in like I am a racist person or I'm anti-racist person, but as in like this is about someone else. This is about a community. This is about many communities. This is about the people that came before us and allow us to be here, and made all these sacrifices and these things that did very important things that allow us to move forward, and in my case allowed me to go to another country and have access to higher, better education. So when the conversations happen around you where you're ready to be part of it, Just remember, no one is trying to call you racist, and anti-racist work is not one thing that happens. It's not one action that happens. It's continuous. Like it's kind of how you keep up with a house. Like you need to continue doing housekeeping and cleaning and organizing and taking care of every single aspect of the house. Like you just don't get a house and that's it. Like there's a lot of work that needs to continue be doing, and we learn new things about racism, and then we learn new things on how we are or are not part of the problem, and how we are or are not part of the solution as well. I just wanted to add that.
And if I can just add one thing as well, or two things maybe. I think as we begin to have these conversations, one important thing to consider is just the process of our own self-reflection. So really trying to think about what have we as individuals been taught about race and ethnicity, what was taught within our families, what is being taught within our communities and other social circles through which we exist. The other pieces are, trying to better understand our own thoughts and feelings about race and ethnicity and experiences that we may have had. It makes me think a little bit about Andrea was saying about kind of some maybe different generational effects that are being seen, but thinking about what we also want to be able to share with others, whether that's with our kids or in our ohana or with peers also. And so really just starting with some self-reflection, because inherently, even people of color, there is inherent privilege and bias for everybody. And really trying to identify some of those pieces, I think, is really helpful in then moving the conversation forward. And then the second piece I wanted to just touch on briefly is thinking about both racial and ethnic socialization. Again, I'm coming from the lens of working with children and adolescents. But I also think there's some important things that we could do here. This topic area includes things like both what's said and what we don't say, what we do and what we don't do, and the emotional reactions that we have as adults as well. I think there's also some very practical things that we can do with kids of different ages. So for a younger kiddo, that might be reading a book that includes characters and individuals that come from diverse backgrounds, for example. And then something more practical you might do with an older adolescent is having an actual conversation about the challenges that they may face related to race and ethnicity. I'll stop there.
Okay, so I think kind of following up with that, because of your work with youth and in trauma and a lot of that, some of that potentially stemming from racism, in terms of the adverse childhood experiences or ACEs, racism is not identified as one of the ACEs or traumatic experiences, and I believe there's talks to include that potentially along with bullying. And so just kind of what's your take on that? Do you feel that that's important? And then, what are the psychological impacts and trauma?
Sure. So the original ACEs study is both super interesting and has some growth areas. So this was done with a primarily Caucasian population. I want to say, I have this right, it might have been almost like a 75% of the participants were primarily white identifying, and was done with folks who were primarily insured, and also really focused on trauma and adverse experiences within the family system. So there certainly have been calls for expanding beyond that to community forms of violence, factors like racism, factors like bullying. And I think there's actually been some early work that's being done in that area. There's some, because of the original studies that validated the measure as is, there's some challenges to just adding items, but I think there's certainly work to explore how what exists can be expanded upon, and how we really can look at trauma and factors like racism as a broader construct. One of the biggest take homes from the ACEs study was just really the cumulative effects of adverse experiences on the individual. And this is both with health and mental health outcomes. It's been replicated with other samples. And so I think we can then easily extrapolate again that other factors of whether it be peer, community, violence, again, things like racism, discrimination, also really have a role in that as well. And then I started this earlier by kind of talking about the sample. So the other piece that's really important here is studies that identify forms of trauma that are specific to the populations that are being served. And so the other important piece of this work is really including people of color in the studies that helps with the applicability of the findings that we identify as well.
Okay, would anybody like to add on to that a little bit there? Okay, good job. Next up, Blanca, I just wanted to follow up on one of the last things that you were talking about, and you brought up the issue of microaggressions. And I think that kind of links into what Pua was just talking about too, in terms of that kind of cumulative effect. But I wondered if you could kind of expand on the topic of microaggressions and how, potentially the cumulative effect and the trauma that can potentially cause. But just some even examples of microaggressions. And I think a lot of times when people bring things up, it's, oh, you're overreacting, or it's not, not that big of a deal. And so I guess if you can talk about microaggressions and why they are a big deal.
Yeah, so the best way that I understood microaggressions the first time that I came across the term, it was an example of a mosquito bite. So I'm assuming a lot of people in this conversation are already familiar with the mosquito bite example. So you get a mosquito bite once. It creates like that little thing there. You just can ignore it throughout the day. But 10 minutes after, another mosquito bite right next to the other. Then another mosquito bite on top. Then you're driving, and then again another one, and then that little tiny mosquito bite that in the morning you didn't really care about, and you were gonna be able to get through your day. At the end of the day, with so many mosquito bites on the exact same area, are so annoying and painful and probably concerning to you that you cannot think about anything else but that mosquito bite and your arm having that effect. So that's the way microaggressions work. So very recently, I was going through a drive-through with my boyfriend, and I was ordering some food, and the person on the drive-through, she could not understand my order, and it didn't work. So I was like, forget it, I'm not gonna get anything. So we kept through. He got his order, paid for his order, and we continued going. And I felt the need of explain to him why I was so upset, like why this is not me making a big deal about not being able to get my food. And it's not just that I'm hungry or I'm mad at the world, no. It was that throughout the whole week, I've experienced so many different situations that reminded me that I do not belong here. I do not speak the same language. I don't look the way you want me to look to be able to offer you services or access to the services that you're producing or their offerings. That I should not be working in professional settings, like that people. And this is and on how I come to that is like an example of people looking at the street and I have my face mask and they're like, oh, here I see you again. You're working at that whatever restaurant. I'm like, no, I've never worked at a restaurant. Like how do you assume that because I'm Latina, I have to work at a Latino restaurant? People explaining, for example, another example, people explaining to me using words in broken Spanish to explain to me something that they can use plain English to explain to me. and not asking it like, is it okay if I speak in your first language, or is it okay if I try to speak in the first language? So many of those things happen in the same week, in addition to me being tired, like not only physically tired, but also emotionally feeling like I'm an outsider, I don't belong here, I need to prove myself, I need to work harder to be able to prove myself and be able to prove others that I may have something to contribute with. In addition to not being able to place a simple drive-through order, I was like, I don't even want to eat. Like what for? So the kind of the way that's another way racism operates, and it's like it gets inside our idea of like what is better and what is not, like how we're supposed to look like, how we're supposed to what do we need to appreciate better, who is going to get farther in terms of professional careers, and that expressing to how others treat you or how you treat others, or the way it expresses on how you treat or others treat you is sometimes microaggression, is sometimes without you intending, or without the person at the drive-through, which probably doesn't even know what happened. She probably thought it was like the phone was broken or something like that. But to me, it was like enough to decide that day I don't want to eat. Like that day I'm done. And my boyfriend right there, he was trying to kind of like make things light, and I was like, I'm so sorry, but you either acknowledge what just happened, or you're gonna have to ignore your whole life that we're gonna have to experience these things every single time. Like this is not gonna happen right now, just only. This is gonna continue happening. People are gonna continue questioning my accent. People are gonna continue not understanding what I'm saying. People are gonna continue reminding me that I don't belong here. And if you're gonna ignore it now, you're gonna have to ignore it your whole life. And I just cannot. I cannot. So sometimes when we when we engage in conversations and like try to like, let's say, try to understand someone who doesn't speak English as a first language, and we don't understand and we don't understand what they're saying, and just assume what they say, that and the person acts differently, and the person gets like a little bit defensive with like, I was not doing anything. But what we don't see is all the other experiences that that person at the other end has had to go through to be able to get to you, to get the answer that that person is looking for, or get the service that that person is looking for. So, and I'm pretty sure that both Dr. Andrea and Dr. Puanani may explain much better the way in which microaggressions can work in making our own belief for where we do belong. But the piece that is really important to the work that we do with immigrant communities and those who don't speak English as a first language in our team is the fact that you're here already. You made all your way to talk to me right now. And whereas, like, even if I don't speak your first language, or if we do have some type of relationship in terms of like immigration, in terms of like same gender, in terms of like sexual or gender minorities, like whatever it is that connects us, I'm not gonna let you go until we try whatever you need to get access to, and we try to get you connected to the service. Because just sometimes it takes just one act of not seeing the person, or ignoring the need that they have, or just assuming it's not as important, for them to just never come back to you, or never come back to the service. So I guess that's why that would be kind of my connection to how public health, racism, and microaggressions work. But I'm pretty sure my companions can do a better job explaining on how it actually operates.
No, I mean, I think you did a fantastic job explaining that. And I gave a very clear visual of that. And I think it actually segues really nicely into our next question, which is for all the panelists. which is, what do you see the next steps in the fight to eradicate systemic racism, both at that individual level and institutional level? And I think that Blanca really started to touch on that, and in terms of the way that we interact with the people who are seeking our services, and not making assumptions, obviously, about where they come from, what they've been through, and how they got to you. So if either Andrea or Pua, we want to start with you, and then we can kind of go down the panel there. Okay, fine. Andrea, you start.
Oh, Pua took herself off mute, so I'm gonna let her start. So the next steps, I think that's a really difficult question, and I think it's a really I think a lot of these questions can deserve like an hour in and of itself, and so I think, one of the first steps that we've been talking about is like this aggregation of data, which Blanca alluded to as well, like kind of, and getting what Pua talks about, like getting the right representation, or getting very diverse representation on different studies that we do, looking at the problem, but also more importantly, like we know that racism exists. We know that it exists on multiple levels. So what are we gonna do about it? I think like in my work personally, in my research, I spent a lot of time trying to assess it and measure it and validate that it exists for Hawaiians and Pacific Islanders. And now it's like, so now what are we gonna do about it? And having the right partnerships and getting community voice involved and at the table. So kind of to Pua's point the last time, it's not only about who's at the table, it's really focusing on who's not at the table to have these discussions and to make the changes that we need to see on a societal level and a community level, and even on an individual level, I think is my quick answer to that very important and big question. So thank you.
Okay, Pua.
Yeah, similarly, I got the question list and I was like, oh my goodness, these questions are so well done. And they're big questions and they're hard questions. And I think when we encounter the bigger and the harder questions, it can get really overwhelming. So I think Andrea's already, well described several of the things that can be done. And just to echo, I think it's a multifaceted approach. There's definitely a research arm to this. I think there's we started today's talk really talking about policy, and I think there's a big policy and advocacy arm to this as well. And then there's the practical, like what do we do? Who do we have at the table? Who do we not have at the table? Who do we need to get to the table? And it kind of these almost like the concentric, that Bronfenbrenner's model, the concentric circles of where people interact, starting at the individual and really getting to like on the big picture society. So while I think that, again, it can get really overwhelming to think of what's next or what do we do, I think we've talked about some of the really smaller practical next steps, whether it's that we can all even take home today also, because I think part of this is like, what's the small part that I can chip off and do myself and do with my ohana or my peer group or my community in light of this important work. And so whether that's, the self-reflection, whether that's the conversation, whether that's continuing to gain knowledge on the issue, whether it's participation in a professional or personal hat that you wear in any of these different segments. A big work, but not impossible work.
Okay, Blanca, did you want to add anything to that?
Kind of a little bit of an action item. Same with the who is at the table and who's not at the table. I think an exercise that I try to do often, maybe not as often as I should, is look to your right, look to your left in all the spaces that you are. Like either like if it is just friends, even if it is just a night out when we go back to those night outs. Is professional settings, if you're part of decision-making tables or just community conversations, just make sure that the person who is to your next, to your left and to your right, they don't look exactly like you. And I don't mean exactly like in terms of the skin color, but I mean exactly in terms of backgrounds. Like you want to have conversations. You want to be able to diversify all the spaces, like or support diversification of all the spaces. It means not only having like immigrants at the table and having people with access to higher education, like college education at the table, but you also want people that may not have had access to education at all. Like you want to have, and the first example that comes to mind is farmers, immigrant farmers. Have them at the table if you're going to have conversations about, I'm going to say food access, you know, so make sure you provide the space for them to speak. Having them at the table, having the color at the table represented is not enough. Like there gotta be a space for us and for them to be able to speak. Even if the conversation is gonna be much longer, or even if the conversation is gonna make others uncomfortable. That's a first step. Like if it makes people uncomfortable at the table, I think we're doing a great job. I think that's kind of the first step. Like let's make us and ourselves uncomfortable and make others uncomfortable with how things are right now are not working with everyone or for everyone. And if we can just check. Just make sure you make connections with others that are not part of your circle.
Great, thank you. So just want a reminder real quick, we're gonna move to question and answer here pretty soon. So if you have a question, a burning question, hurry up and put it in the chat so that we can try and get that to our panel. And also just a note that we are going to be showing about a short, like 1 minute video, I think, at the end, after the end of the question and answer that was put out by the National YWCA at their Stand Against Racism panel today. And it's called Until Justice Just Is. So we encourage you to stay at the end of this to watch that. But moving on to the final question that we have for you, for all the panelists, it's really just how, we've talked about next steps, but on the personal level, how do we initiate these conversations with our family and friends who may have different experiences than us or may have different views than us? How do we kind of initiate those hard conversations, but still maintain those relationships, I guess? Whoever wants to start with that one. Okay, I'm going to call names.
I can start. I love that question, actually. I think that what Blanca did so nicely with the microaggressions is like tell personal stories, be vulnerable, create opportunities or share examples of when you, or maybe you either did the microaggression or something like that, or when you were kind of the target of that. I think that can create the space so that they realize that you're not perfect and you're not trying to like scold them or tell them what to do, but you're inviting conversations. And I think, as a psychologist, we're really not trying to change people. We're trying to help them kind of clarify where they want to go, and using some of those strategies, like actively listening, even if you don't agree, kind of reflecting what you hear, allowing the opportunity for them to meet them where they're at, and for them to move at the pace that they feel most comfortable with. Because I think, if they come back and have the conversation with you again, that's also a win. And we have to, like, for me, I talk about this a lot. I talk about it in a lot of the spaces that I'm in, but I realize more recently with what we've seen on the news locally, that my family members don't have these conversations regularly. And we've even talked about what they see on the news and what does that mean to them, and where do they think they get those narratives and assumptions from. And so kind of just asking questions without judgment to create that space to then move forward for what I consider forward in terms of awareness or change sometimes.
Okay, who wants to jump in next? Pua?
Sure. so in addition to all of those pieces, I also think sometimes about the preparation for the conversation and then the what we do, maybe in addition to or parallel to, or sometimes instead of. I don't want to take away from the actual conversation because I think it's a really important piece to all of this. But so on the preparation side, I think maybe starting to initiate some of those conversations in the safer space with the folks who maybe do have who you do feel comfortable conversing with the topics about, just as practice for having some of these conversations in settings or with individuals where it might be really important to do so, but might be more difficult to do so also. And then the other piece I'm thinking a little bit about, just in parallel to this, is what we can do somewhat behaviorally that results in a shift or a change in viewpoint and then can facilitate further dialogue. The one example that comes to mind for me, I think, is, many folks, this is, I think, certainly generationally focused. So my Hawaiian grandmother grew up in a time where it was very shameful to be Hawaiian. She did not learn to olelo. She, I think she actually did dance hula, but when she was in her later years, her husband, who was full Chinese, actually spoke Hawaiian and was very good friends with folks in the Hawaiian community. But her perception was very negative. She did send my father to Combe schools, but that's only because the school she sent her older two kids to didn't really work out so good. But she also made very negative statements about Native Hawaiians, a lot of the stereotypical things, so dumb, so lazy. And I think we really saw a shift in her behavior when some of our family activities changed because of my going to Kamehameha for intermediate and high school. And so I think just that developed in her some openness. So I say that not to say that this is the right way to go, but more so to provide an example of how just changes in what we do and changes in experience can also help to facilitate dialogue and can shift attitudes and beliefs as well.
Thanks. Blanca?
I don't think I have any better tip to add to what Dr. Andrea and Dr. Puanani expressed. Just if you feel like the conversation is going to be a little bit too hard to have, or like maybe touching into to some of the, I'm gonna turn around that idea. Have some ideas on how this can be better for everyone. What is in it? What is in it for them? Like what is gonna be of all advantage for like every single person if we address the problems of racism? And there are plenty of studies, there are many examples of how things get better when we embrace diversity, when we address racism, when we open opportunity to everybody, and all communities have participation in like at all levels, like not only local policy, but also like more statewide or national policy. So just even though maybe that conversation can be a little bit hard, and I think the tips that both two panelists shared really good for you to actually hold conversation. Just keep in mind, this is just for the betterment of everyone. It doesn't leave you outside. Like it doesn't mean less for you. It means more for everyone.
That's an excellent point. Okay, so we had a couple questions come in. I'm going to move to those. This one is specifically for Andrea. Another common topic that comes up when addressing racism in Hawaii is the idea of reverse racism, that the white community faces more racism here. How do you, I guess, respond to that and or counter that point of view?
Yeah, so I think the way that we've talked about it in the work that we've done around implicit bias is that there are negative stereotypes about whites in Hawaii, just as there are negative stereotypes about Native Hawaiians and Micronesians in Hawaii. So we validate that point. I think though, if you look at like socioeconomic status by per capita income, if you look at people in power in different large organizations like University of Hawaii at Manoa, there's still an overrepresentation of whites and Japanese Americans in those positions. And so in some of the implicit bias data that we've collected using implicit association tests that a colleague, Dr. Delafield, and I developed for Hawaii based on like Hawaii specific communities, racial and ethnic communities, we see though a slight, on average, with a very small sample size of like 28 people, there is a slight preference for Native Hawaiians compared to whites. And so we talk about that because there are very strong negative stereotypes that are associated with whites. And sometimes that leads to discrimination against them. And I think if we look at the system of inequity that the coin model talks about, Nixon put out a coin model, there's still kind of unearned privilege given to white communities in Hawaii and unfair, unearned disadvantage given to other minority groups here. So kind of understanding the context of Hawaii and how racism plays out here is important to the conversation. So that, I hope that answers that person's question.
And thank you. And then we just have one more follow-up question that came in for Blanca. It says the CDC has declared racism as a public health threat, and how can this help move this work forward?
Can you repeat the question? I'm sorry.
Sure. The CDC has declared racism as a public health threat. How can this help to move this work forward?
I think that connects a little bit with the other question about how, like, are we announcing locally or like in terms of a state that public health is going to be racism is a public health issue. I think it connects I think it provides the spaces. I think it brings the issue into conversations that otherwise would not be happening. It puts it into the loop, or it puts it into the radar. So when we're thinking about where is the funding gonna go, then having racism as one of the factors that we need to take into consideration of addressing a specific health issue or a specific access issue, then we're going to be able to address it because we're recognizing it as this is part of the problem. I'm going to go back to what I shared. It is like for me, much preaching to the choir is great, is wonderful, it feels like it's encouraging, but the conversations and the priorities need to start shifting and moving into those places where those conversations are not happening. And I think that is having it part of the CDC priorities and having it as a important factor to address when we create policy or when we implement programs or when we decide where funding is going to go. That's great, that's wonderful, and yeah, let's do it. But if just by just adding it as a name or as an issue, or as I said, like putting just the color on the table, that's not enough. Like it needs to come with action, just so it means something, at least to the communities that we want it to mean something to.
Okay, thank you so much for that. And I just really want to thank each of you so much for participating in this panel and bringing your wealth of knowledge to our community and to and all the hard work that you've done on these specific issues that you continue to do. And we look forward to, as a YWCA, hopefully partnering and working with you and being able to tap into your brains for more information and assistance and help. And so thank you so, so much for being here today. And hopefully this is just the beginning of this conversation, and that we'll continue to follow up on this. So I would encourage everyone to stick around for the video, very short. So if you can, please do. Otherwise, thank you all so much for attending and participating and listening to this information that we've been given today. Thank you all.
We hold these truths to be self-evident, that all people are created equal and born with certain unalienable rights, including life, liberty, and the pursuit of happiness. But all too often, that truth is forgotten. All too often, those rights are ignored, as all too many stand in silence and all too many suffer alone. So our work goes on until the land of the free is free of racism, until the home of the brave is brave enough to change, until by the people and for the people means doing right by all the people, until justice just is.
All right, thank you, everybody. See you later. Bye.